Good afternoon, everyone, and welcome to Safe Food, Healthy Kids. I am Lisa Triber. I am one of the extension educators that helped develop this curriculum. I am based kind of in the middle of Michigan, right in Midland, Michigan, and I will let my other two co-presenters introduce themselves as well.
My name is Kara Lynch, and since we're using our hand, I am also pretty close to Lisa in the middle of Michigan, also specializing in food safety as well.
And good afternoon, I'm Lori Messing, also a food safety extension educator. And since we can use the state of Michigan as our map, I'm in the thumb, and we do reference ourselves to living in the thumb and working in the thumb of Michigan. So that's where you would find me. So welcome.
All right, so we're going to get started. And again, welcome and thank you for joining us today. Michigan State University Extension's Safe Food, Healthy Kids curriculum is a comprehensive food safety education program for childcare providers. In Michigan, there are no requirements for providers to take food safety training, so this curriculum was intended to educate childcare providers on food safety best practices and pass on lessons learned with the ultimate goal of reducing the incidence of foodborne illness in this vulnerable population. Sessions will learn about the evidence-based Safe Food, Healthy Kids curriculum, best practices for implementing the workshop, lessons learned using technology to maintain engagement with participants during online sessions, and how to access the curriculum. We will also share how successful partnerships with childcare organizations have helped reach a larger number of providers, and how we utilize technology to supplement the workshop using a texting campaign. So you're probably familiar with the statistics from the Centers for Disease Control and Prevention, which estimate that 48 million Americans become ill with foodborne illness every year. And of those, up to 3,000 people die. National data indicates that foodborne illnesses are estimated to cost the economy more than $93 billion annually. You may have been familiar with those statistics that I just shared, but did you know that children under the age of 5 account for half of these illnesses, and that children who attend childcare centers are twice as likely to experience gastrointestinal illnesses as those who do not? Children under 4 years of age are 4.5 times more likely to get bacterial infections from food than adults aged 20 to 49 years. Long-term effects of foodborne illness can lead to kidney failure, chronic arthritis, brain and nerve damage, and even death. Children also have limited control over their diet and related food safety risks. Childcare providers furnish the bulk of children's nutrient intake, yet there is a lack of food safety education or requirements for training. Childcare providers have the potential to positively impact this high-risk group, and as a trusted source can also provide further reach to families of the children that they care for. Safe Food, Healthy Kids was developed for extension educators because there was no comprehensive food safety curriculum directed to childcare providers in Michigan. Safe Food, Healthy Kids gives providers the tools and education they need to prepare food safely, sorry, I'm tripping over my words here, and decrease the incidence of foodborne illness in children. Based on the FDA's food code, Safe Food, Healthy Kids is an interactive food safety workshop. The goal of Safe Food, Healthy Kids is to reduce the incidence of foodborne illness in children and the accompanying health disparities. The program provides PowerPoint slides and a playbook, which includes supporting food safety resources and materials. In 2016, we identified the need for food safety education for childcare providers, and we began our research. We started piloting in 6 counties in Michigan in 2017. These counties consisted of rural and urban audiences with a grant from the Michigan Health Endowment Fund. The counties had higher rates of poverty and a greater percentage of children under 18 years of age residing in them than the state average. In 2018, Safe Food Healthy Kids was expanded for statewide programming, and in 2020, we further expanded our reach using a virtual format. We received copyright approval in 2020 as well, and we're excited to share this program with other extension organizations. Childcare providers may not have formal training requirements in food safety, but they are preparing and serving food to one of our most at-risk groups. Thus, the need for food safety training is critical. In March 2020, when the stay-at-home order began in Michigan, we were in position to quickly pivot Safe Food Healthy Kids from a 3-hour in-person training to a virtual 3-hour training. The virtual friendly format was designed to engage providers using polls and discussion questions. The downloadable PowerPoint is complete with speaker notes and prompts for activities and handouts, which are coordinated with the playbook. We have included some knowledge check slides and discussion questions for you to engage with your audience during the presentation. These work especially well for in-person classes. We've used Zoom webinars for our online programming and transitioned the knowledge check slides to using poll questions as a way to keep the audience engaged. I'm going to pass this over to Lori now.
Great. Thank you, Lisa. Safe Food Healthy Kids is facilitated by food safety extension staff. The curriculum includes a PowerPoint presentation featuring interactive activities, videos, and storytime slides. Storytime slides are embedded throughout the presentation to illustrate relevant, factual foodborne illness cases, highlighting the importance of food safe practices in childcare settings. The curriculum also includes a playbook facilitator guide with handouts for providers, including online food safety resources, a list of children's books with food safety messages, MSU Extension's Safe Sanitizing and Disinfecting Fact Sheet, at-a-glance reference cards, an evaluation, and a participant certificate. The evaluation has been adapted with permission from Penn State University Extension for this program. The Safe Food Healthy Kids PowerPoint consists of a 133 slide deck. There are 9 sections or chapters in the presentation, including the facts and costs of foodborne illness. The curriculum begins by setting the stage about foodborne illness in the United States. Participants will learn the difference between an outbreak and a foodborne illness, as well as foodborne illness statistics, bugs, and the problems they cause. This section provides the science behind foodborne illness. Initially, we didn't include much about the science behind foodborne illness. Then during our pilot phase of the curriculum, we were surprised to learn participants were interested in learning more about the different types of foodborne pathogens that can cause foodborne illness. So this section explores those pathogens and hazards related to food safety. Preventing foodborne illness is our next chapter. Important concepts such as time and temperature control for safety, FAT-TOM, and the temperature danger zone are key concepts covered in this section. Personal health and hygiene. Hand washing, glove use, and illness are featured in this section. Focusing on the health of childcare staff and the children is important for a safe childcare environment. How food moves through your kitchen. This section explains how food moves through kitchens, from purchase to receiving, to storing, to cooking, cooling, and serving food. A clean, safe childcare environment. Understanding the difference between cleaning and sanitizing is critical. Key concepts are shared in this section to stress the importance of a clean environment and how to do so safely. Food for thought. This section includes a variety of topics, including things like safe feeding guidelines for infants and toddlers, as well as safe field trips, using home preserved foods, just lots of different other topics related to different aspects of food and its safety in a childcare setting. Deadly lookalikes. A quick look at common items often available in homes that have similar resemblance to harmful items if consumed. So this section has slides showing, for example, purple cold medicine that might look like, purple grape juice, or mints and vitamins or candies that might look like different types of cold medicine as well. And the last section, share what you know. This section has a summary of ideas that child care providers can put into action and engage with their staff, as well as with kids in their care for food safety activities and education. Story time. During our presentation, we have added stories from the news where young children have been impacted by foodborne illness. It is our hope that by sharing these stories, our participants will realize foodborne illness can happen in childcare settings and understand the importance of having good food safety practices in place to make a difference. The Safe Food Healthy Kids Playbook, or Facilitator Guide, if you wish to call it that, provides guidance to the presenter. In the playbook, you will find tips for setting up virtual or face-to-face programs. This curriculum did start in person, so we do have lots of activities that can be used with in-person settings, before it was transitioned to a virtual. Presenters will find icebreakers, activities, in-depth guides for each section, as well as recommended handouts to download and share with your participants and the accompanying resources. The playbook is a wealth of information to guide educators through implementing the curriculum with your childcare providers. In Michigan, participants can subscribe to a supplemental and optional weekly texting program, which shares food safety messages each week. And in our case, they come out on Friday mornings. The message may contain links or videos or a specific message for the provider related to something food safety. By using texting as an innovative approach to education, our participants can enhance their knowledge after attending our training session, as well as they can receive reliable and trusted resources and information they can share with their staff, with their coworkers, or even with the parents of the children they care for. If a texting program sounds interesting to you, we would certainly be happy to share details on what platform we use and how we set up our program later on. You can simply contact one of us and we can share that information with you. So it has been kind of an interesting additional enhancement piece that we've used with this program. On this slide, you can see a couple of examples of the weekly texts that have been sent. So what you see here is kind of two different texts, and in each grouping on the left is the text content that was received. And then on the right, it shows you, what resource or what, again, it could be a video, it could be a document, it could be a website that the content directs the provider to once they click on it. So the examples on the screen, one's about hand washing, and the other one, I'll make mine bigger here, I can't quite see it. The other one is, well, actually they're both kind of one's about hand washing and one is about preventing foodborne illness and sending them to the Food Safety Partnership for Food Safety Education website. This has been a successful reinforcement for childcare providers. Food safety concepts taught during Safe Food Healthy Kids classes are shared, and childcare providers can pass them on to staff and families. So it has been a really nice supplement for our program. Our partners. Safe Food Healthy Kids provides 3 training hours towards Michigan's annual training requirement for childcare providers. In Michigan, Great Start to Quality provides ongoing education to childcare providers and has been a key partner in our success with this program. My Registry is the Great Start to Quality's online professional development system. And this is where our classes are promoted, they're marketed, they're linked, and childcare providers, in turn, after attending, their training credit is documented in what is called the My Registry system. So you may have a different system or a different type of platform in your state, but this has been a great partner for us. Providers are looking for training options, and they can go to My Registry and see trainings all around the state of Michigan that are happening, every day. There's many, many, many trainings that occur. And so it's a great way for us to market directly to childcare providers. Partnering also with childcare centers and homes and speaking at statewide and local early childhood conferences have also boosted our program reach. And if you are interested in this program, I would definitely encourage you to think about partnering locally. In my case, in my area of the thumb, as I mentioned, I did have a lot of success in working with childcare centers to offer training at their center to their staff. Normally it's done after hours, 6 o'clock at night, which is fine. It's part of the process when you work with childcare providers. They're busy all day, but that's been a great success to be able to reach providers, at an easy location for them. There's no travel involved, and you can, train their whole staff at once. So doing those options as well as speaking at conferences really has boosted our program reach and provided us with a lot of success. We also started 2020 with a new partner, the Association for Child Development, to provide an online session for childcare providers in the states of Michigan, Illinois, and Indiana, which is what the ACD covers for their landscape. Utilizing online technology as a platform to provide safe food, healthy kids, the Association for Child Development class ended up paving the way for safe food, healthy kids to be offered virtually. Little did we know in January of 2020 when we did that not too many months later, we would all be shifting everything virtually. So it was a great start for us and made our switch to virtual quite a bit easier. Creating partnerships with these organizations has been key to our programming growth. Looking at our success in Michigan, we recognize the value to making this program available nationally, considering the need for education for all providers, as well as the health implications foodborne illness can have on children, which is why we're sharing this presentation with you today. Sample marketing materials. Marketing is done in a variety of ways to promote our program, including weekly postings on our Think Food Safety Facebook page, as well as sharing with our entire MSU Extension network, mailings to childcare providers, and press releases. So we have done quite a bit of marketing in quite a variety of ways. And as we said earlier, we enter these trainings onto the My Registry professional development system, and that gets right directly into the hands of childcare providers as well. Between 2016 and 2020, we have educated 1,289 childcare providers. Of this number, 357 have attended an in-person session and 932 a virtual session. So you can see the growth we had once we went virtual in 2020. The audience has grown substantially since moving to virtual, over 1,800% of an increase. and the number of participants in our in-person programming. Each year in December, we will reach out to you with a short survey requesting you share with us the number of Safe Food Healthy Kids sessions you offer in your state and the number of providers who attended, which will allow us to see the reach happening with this program and with this curriculum nationwide. We're not looking for evaluation data, simply participant numbers. All right, I'm going to turn it over to Kara.
Thank you. All right. So the total number of children who were served meals and snacks by our class participants, according to the numbers that Lori just revealed to you, so the reach we had to children was over 32,000. This large reach to children demonstrates the importance of childcare providers using, hopefully at least, safe food practices when they're serving the food to children in their care. We also discovered through data collection that most providers are serving 3 to 4 meals and or snacks per day. So they really are a main source of nutrition for the children, that you're probably all aware of that. So the demographic outreach that you're looking at on this screen, we're comparing the demographic distribution from a combined year of 2017 to 2019 and comparing it to 2020. So we certainly have been working to expand our participant diversity, and going virtual has really made an impact on that. So self-reported data shows the diversity of our participants in 2020 that, just to highlight the numbers, shows 52% of them are Caucasian, 24% are Black, 4% are Asian, and 1% are American Indian. And just comparing that to the graph on the left with where we collected data showing that our audience was mostly Caucasian, with about 96% of our participants being Caucasian. So the increase in 2020 as displayed on the charts is due to our transition to online programming. And this really just created opportunities to reach a larger and more diverse audience throughout the state of Michigan. We also have been able to reach participants in over 84% of Michigan counties, and the ethnic diversity increased by 30%. We also wanted to share with you some of our program outcomes. So these were collected using post-class evaluations, and we measured both behavior change as well as knowledge gained. So data shows that we have been able to improve food safety knowledge and practices in the providers who have attended our class. On this slide, we have the knowledge-based outcomes that I want to just review with you and highlight. So these were self-reported, of course, and it shows an increase in the following areas, that 84% of them will or learned more about foodborne pathogens, 72% in the area of cleaning and sanitizing, 76% in the area of cross-contamination, and then 87% noted an increase in their knowledge in the area of controlling temperature. This slide highlights the behavior changes that we assessed through attending this class. So participants said that 41% of them will use an appropriate strength sanitizer on utensils, on equipment, and food contact surfaces. 69% will cool foods quickly. 58% will limit the time that food spends in the temperature danger zone. And 47% will cook foods to the proper temperature. And then lastly, about 69% said that they will check food temperature with a calibrated food thermometer. Childcare providers are learning and implementing food safety best practices in both their work and home environments. So we wanted to also share with you many of the comments from providers that they said that they learned after attending our program. So on this slide, you can see just a few examples. We tried to get the most common comments that we received from participants from our evaluations. And so these are some of the comments that they shared. Some of the more, again, more common ones are that they learned how to properly thaw and store food, as well as the difference between a sanitizer and a disinfectant, and the amounts needed to effectively make their own food safe solutions. A lot of participants were just really engaged, especially when we were had a lot of more questions about cleaning and sanitizing when we were in those chapters. They also learned about foodborne illness sources, and many said they're not properly cooling foods. And also they were not aware about the strengths of different brands of bleach. Providers shared that they can use information learned not just at their childcare sites, but also at home. We also wanted to share that other comments state that they learned how to calibrate thermometers. They learned about the importance of using a thermometer and how to use a thermometer. We know many people don't know how to use one correctly. Understanding what that temperature danger zone really meant by having that definition and that explanation provided to them, what the cooking temperatures are, and then how to keep food safe in that zone. And then again, bleach was a common topic highlighted by participants. So for example, we spend time having them identify what the percent of sodium hypochlorite is on their bleach bottle if they have access to that. And so we discuss how to look for that, and then shopping for the correct bleach to use. So we've really appreciated all of the great successes shared with us by participants. And we're happy that the program has provided food safety education and encouraged the use of best practices when preparing and serving food for their children. We keep trying to bring that focus back to them, that it's really, really critical on what they do in their own home. This is private, but they're taking care of children, and we really want them to do things correctly. So as Lori mentioned, we talked, and Lisa a little bit talked about our online classes. So we currently are offering Safe Food Healthy Kids at least once per month online. So we invite you to join us for a free session to participate in the entire training if you're interested. So you can find our current class schedule and then registration information once you find a class you're interested in on our website. And Lisa or Lori are going to add the link to our Safe Food Healthy Kids webpage in the chat. So once you open that up on our website, you can scroll down to the toolbar, and there's an events tab there. You just have to click on that, and you can see all of our classes that we provide. And that will take you into our registration information. So the Safe Food Healthy Kids curriculum did receive copyright protection in 2020. So our hope is that many of you are interested in programming this in your state. So if you choose to do that as a copyrighted project, we just ask that you not delete or alter our materials. You can add slides, especially with something like data relevant to your state, for example. You can add that to our PowerPoint presentation, or you can hide slides that you may not be interested in presenting, but we ask that you not delete slides. So one example is if you wanted to add a presenter slide with your names, of course, your extension logo, also any state-specific foodborne illness data, or maybe you have some specific childcare licensing guidelines related to food safety that you want to highlight. That would be the time when it would be acceptable to, and we would encourage you to put that information in the PowerPoint presentation. We did also want to share some of our successes with you. So since this project began, we've been fortunate to experience some of the successes I'm going to highlight. Initially, when we were developing this curriculum and then piloting it, we were the recipient of a Michigan Health Endowment Fund grant, and that allowed us to complete the curriculum and pilot the project. And I do see some good questions that have been posed in the chat, so we will, during the Q&A portion, we'll touch on those as well. We also received some NEAFCS state, regional, and national awards. So in 2018, we received second place in the Innovation and Programming Award, second place regional. We also received the Clean and Healthy Families and Communities. We were a Central Region winner. We received a first place Regional Food Safety Award. And then in Innovation and Programming, we were a state award winner. In 2020, then, we received the Food Safety third place National Award and a second place Regional Lawrence Hall Award. And then this year, we were fortunate enough to receive a first place National Early Child Care Training Award. And then, as I mentioned, we secured the copyright that allowed us to move forward with rolling this program out nationwide. We also have been invited to speak and or display information about our Safe Food Healthy Kids program at a variety of conferences. So one of those was at the Consumer Food Safety Education Conference, the national conference in Florida, where we presented a session. We also presented at a Community Sharing for Healthy Caring. That was a state level conference. And also another state level conference that we presented at, or had a poster session, excuse me, which was the Michigan Association for Local Public Health. And then we've also had a booth at the Academy of Nutrition and Dietetics State Conference. And of course, we're lucky enough to be able to present and share this information today too with you. So these opportunities certainly have allowed us to reach new and larger audiences with our curriculum and our materials, as well as provided new methods for program promotion, and then helped us to grow the program. We're blessed with it to have experienced that. So now that we have discussed this impactful curriculum, we do hope that you're interested in implementing this in your state. So while the target audience, of course, ultimately is childcare providers, please be aware that the access to Safe Food Healthy Kids is intended only for extension educators who will implement it with childcare providers in your own state. So to access this curriculum, we are, Lisa or Laura could also put the direct link into a page that we have. This is also the link that you see on your screen here. So this page actually is hidden from public view. So you do have to have the direct link to access it. So we will also be providing you with a handout, or you'll be receiving it through attending this presentation with this link on it as well. So once you register, there's going to be instructions that allow you to access this course using the D2L format, which is what Michigan State University uses with their students, as well as many classes we use with an extension. So once you've accessed then the D2L course, you'll be required to create an account, and then which of course this is all prompted to you, and then just follow the steps for completing that. And then you'll have access to the PowerPoint and the playbook that we've reviewed. So after everything we have shared today, we'd like to remind you that foodborne illness is preventable. So Safe Food Healthy Kids is a valuable resource to educate childcare providers on food safety best practices and implementation strategies. By sharing our successes, we hope to inspire you to educate the providers in your state. Our experience and data has shown that providing food safety education for childcare providers does have an impact on the children they care for, and it plays a role in keeping them healthy. We wish you success in implementing Safe Food Healthy Kids for the childcare providers in your state. So thank you very much. We do have a couple of handouts, again, that will be provided to you. One is the direct link to the hidden page, so you'll have that, a resource with that link on that. And again, once you've gone through those steps, you'll have access to the material that we've discussed. we encourage you to visit our website for more information. We have some resources as well that we share on a tab on our page, the upcoming classes. And if you have any questions, please reach out to us. We are here to help, and we want you to be successful with this in your state. We did want to highlight the three of us worked with also Eileen Hermanek to develop this curriculum, and we lost Eileen to retirement a couple of years ago. We do miss her, but we were happy that we had her to work with us on this. So that is the end of our presentation. I know that there were a couple of questions, so.
Yeah, Kara, there were, and one of them I answered in the chat, but I'll just expand upon. So there was a question about how long is each chapter, which I didn't really answer because that's kind of a hard question to answer. You know, it kind of depends on, you know, your format of presenting, and, you know, I don't know, Lisa and Kara, I'd say each one might be, I don't know, 10 to 15 minutes. Again, it depends. I think it's just kind of hard to gauge that, but we do allow for a break. So we take a 10-minute break in there. Sometimes we get done a little early. So, you know, the content is not full 3 hours by any means, but maybe 10 to 15 minutes per section would be
Yeah, and I think there's some variation in chapters. Certainly some are longer than others. And,
Right.
Yeah. And then the question about, can learners stop and start, or do they have to do this all at once? So just to clarify, we have been offering it as live session. So a live in-person or a live virtual. And so we normally do the full 3-hour time block, but we have had just recently, probably the last 6 months, we have started doing a 1.5 hour, 2-day session as well, virtually. And then you could definitely, if you were working in person with a childcare site, childcare center, you could set it up to whatever their wishes were. So feel free to, you know, make that work for you as well as the site you might be working with. So there is some flexibility with that.
I do want to add too, just as a learning you know, experience that we had with my registry. My registry is part of the Great Start to Quality, and when we had to all apply to become an approved trainer. So we had to go through the steps that they required and submit like our resume and some different data like that to them. Once they approved us, we also had to submit our curriculum according to their format, and it had to be approved, and it was only approved through my registry for a 3-hour class. So we are allowed to do it in 2 1.5 hour sessions, or probably 3 1-hour sessions if we wanted to. But that's kind of what we have done, is just the 3-hour or the 2 1.5 hour. But we can't, through my registry, you know, we have to give it in a 3-hour block in order for the participants to get credit for that. And the other thing too, with our online classes, sometimes we do have people that log in and they may only stay for a short period of time. And so we start our online classes, and we say it a couple of times in the beginning, especially, that their full attendance is required in order for them to receive credit. We can't give partial credit.
Yep, so that's how our system works in Michigan, right?
Yeah, someone else asked about incentives. And when you're teaching virtually, it could get kind of expensive to mail thermometers and things like that. When we taught this face-to-face, we did give quite a few incentives out. But what they do get when we teach virtually is some accompanying handouts. So they get our sanitizing and disinfecting fact sheet. They get a list of food safety stories to read to the children. They get, oh yeah, there's the index cards that they can laminate and put together. It's kind of quick facts for food safety as far as mixing sanitizing solutions and just some food safety reminders like that. So it's a little different from face-to-face and all those things you would haul to give away versus what you would do when you were teaching virtually like that.
And we did have the grant funding for our pilot year, and so we were able to purchase some incentives with that grant money.
Some coolers and things like that.
Yeah. If you are doing face-to-face though, and do have the opportunity to do incentives, providers love the refrigerator thermometers, the food thermometers. We gave insulated bags as part of our grant for grocery shopping. I think another great incentive we did not do, but if we had money to do so, to give sanitizer test strips would be another really good incentive if you could do that, because that's one area, the cleaning and sanitizing, we've just gotten so much response from providers who learn so much about what they really should be doing for safe sanitizing. And in a lot of cases, they admit they haven't been probably doing it as well as they should. So that would be another great incentive if you did have a grant or some funds and we're doing in-person programming.
Mhm. So there was another question about covering safe handling of breast milk. Yes, we do. We cover breast milk, we cover formula, we cover homemade baby food. There's a whole section on safe handling of all those things that little ones are fed.
And then as far as how are providers liking the weekly text? So that is a great question. We did at one point, and it's been a little while now, we did do a short survey to people who were receiving our texts and got, some limited feedback, with doing it via text, it was kind of challenging. But, and I don't know, Kara, I haven't asked you this in a while, but I don't think a lot of people are opting out. So, I mean, that leads you to believe that, hopefully they're taking a peek at some of it.
Yeah. We do see usually a little jump in our, after we have a class, after we have a promotion of it. But we do get some opt out people that all they have to do is hit stop and they're automatically removed.
And another great question, will you move to cost recovery approach in the future? And that's a great question. We started out with the grant, so we were able to offer this for free. And then not too long after that, all of a sudden we were all virtual and, everything's been free. So Sean, a good question. I guess I'm not really sure, through MSU Extension, we are encouraged to do cost recovery when it makes sense to do so. And with the programs that, seem to be fitting for that. So we do have some programs we are charging for. As far as this one, I don't know, because one thing we hear, and I'm in a very rural part, the thumb of Michigan, and it's been difficult for providers to access training that's low cost or free, as well as travel, because often you have to travel, to provide or to get training. And, as we all know, in many parts of the United States, childcare workers are unfortunately, not being paid probably anywhere near their value and worth. And so it's been challenging. And so I know we like to be able to offer this one for free because we know that they need the training. We know they appreciate it. And we feel like they are really learning. So I'm not sure what the future will hold for that, but it is a good question.
And I will add too, before we did go virtual, we were charging just $10 per person for this program. But, I think Lori summarized it best. Now we've transitioned to free and we may stay that way even for face-to-face.
Yeah, I kind of forgot we charged for a while. It's been quite a while.
Yeah.
Yeah. But yeah, great questions. We do have a couple more minutes here if anyone else has any questions, but we hope you'll check out the links. And like Kara said, we will send you via email lots of information on how to access the curriculum. They'll have our contact information in there as well as in the D2L class. And we hope you think about offering it in your state, and we would be happy to talk with you, and we'd love to hear how it goes.
I had thought of one thing to add to is we are trying to work with the Native American population right now, trying to do some face-to-face possibly or in person or virtual that will play out, I guess. But we do have a significant Native American population here, and we are, definitely we plan to make any material that's necessary more ethnically diverse if to that population as appropriate. So.
And join us. You can see our poster session if you'd like a little later today as well. We do have a poster about safe food, healthy kids. So check that out if you haven't done so already.